And we would like to continue with our, well, actually, the main speaker of the day, the plenary contribution by Professor Miriam Ware, which is actually on the screen. She has to travel to somewhere where it was very hard to have access to internet. So we made a video before the conference, before the webinar, but she will also be supported by a colleague of her who will give a presentation, an extra presentation after the plenary of Professor Miriam Ware. So please enjoy the lecture of Professor Miriam Ware.
My name is Miriam Ware, and I would like to say some words about the MCH Handbook. The MCH Handbook began as Mother and Child Handbook in Japan in the 1940s. From Japan, it spread to other countries in Asia. And then since then, from there, it spread to other countries all over the world, including the USA, where some states are using the MCH Handbook. Now, the MCH Handbook has become a global movement to encourage the use of the MCH Handbook. What is so important about the MCH Handbook that it has become a global movement? First of all, it is because it is one record of the care needed from pregnancy to delivery to child care at birth, newborn, and child care until 5 years and beyond. This is very important to have one record because, generally speaking, these are separate records which are many times lost and disconnected. So it is wonderful to have one record. Secondly, it is very important to have one record because sometimes the condition of the mother during pregnancy can affect the well-being of the child after birth. So when you have the record when you have the information in one record, it is very much easier to counter-check it. Thirdly, the MCH Handbook is a home-based record. It is kept in the home, and therefore we remove the danger of losing documents in health facilities, especially where there are disorganized records. Fourthly, having the record in the home involves beyond the mother, not only the mother. At least the father is also involved. So the father keeps a track of what is needed during pregnancy, what is needed at childbirth, and what is needed for the newborn, as well as how to look after the child. And this establishes stronger fellowship between the mother and the father as they look for their baby, they wait for their baby. Also, the home-based record helps parents to be more informed about pregnancy, childbirth, and newborn, as well as general information on reproductive health and sexuality. This equips them to inform their children as they grow up, especially teenagers, about management of sexuality. And finally, it also helps parents to know what the danger signs at various stages, because when the use of the handbook, the parents are assisted by someone who knows the danger signs of pregnancy, the danger signs of childbirth, the danger signs of newborn and child stages. So it is very important to have this help that helps to support the mother and the child. So this movement has become global, and it is a very encouraging movement in the world. Therefore, Africa needs to be part of this movement. Coming from Africa, this is a major concern for me, not only because I'm African, but because we should be a global community supporting one another. And this wonderful thing that came from Japan can help all of us. And so some of the countries in Africa have already taken up the use of the MCH Handbook. In North Africa, we have Tunisia, and Morocco. In Central Africa, there is Angola, Gabon, and Cameroon. In Southern Africa, so far we have Lesotho. In Eastern Africa, there is Djibouti, Kenya, Uganda, Madagascar, and Mauritius. In Western Africa, there is Burkina Faso, Nigeria, Ghana, Cote d'Ivoire, and Senegal. So a fair number of African countries are already part of the global movement. But that is not enough. We need the entire continent, all the countries in Africa, to be part of this global movement. And why is this particularly important for Africa? Because really, so far, only about 30% of mothers and children are getting the right quality care in pregnancy, in childbirth, and in delivery, as well as in newborn care and childhood. What are some of the factors that make this use in Africa so low? The first one is distance. Most African populations are in rural areas, and most health facilities are in urban areas or in markets. And these are more than 5 kilometers from the families. And from the 1960s, it has been shown that if a family lives more than 5 kilometers away from a health facility, that family does not use health facilities routinely, including MCH services. So that distance between the health facility and the family is a big obstacle. Another barrier is that it is very difficult for young mothers and adolescent pregnant mothers to go to health facilities to get care because they are embarrassed, they are shy, and various reasons. And sometimes it's connected with stigma. So they don't get the help. And since many African pregnancies are in teenagers, over 20% are adolescent, if they are afraid to come to the health facility, it means they are ruled out. Thirdly, there is the barrier of nomadic tribes, nomadic populations. It is already established that nomadic populations have a higher mortality rate generally than the resident population. And this high mortality in nomadic populations is even higher among mothers and children. So it becomes very, very necessary that we address the problem of nomadic populations. AMREF, the African Medical and Research Foundation, which works in the whole of the continent, nowadays known as AMREF Health Africa, has been very active in trying to address this nomadic problem. They did this by training community health workers to move with populations, either by training traditional birth attendants to move with, as they move with them. So the problem used to be that if you say that mothers keep the books, it takes away the problem of having to look for a space. As populations move from place to place, they don't have to have a place to keep the records because they are moving with them. So this solved the problem. But in the rest of the country, we have the problem that we still have dominantly health facility-based services, which are far from the people, especially the rural populations, which are the majority of Africans, and urban slums in our cities. This is why it is very important to have community-based services. And AMREF Health Africa is working very hard to make sure that African countries adopt the community health service approach. All of us in Africa and all of us in the world, our international partners, we need to work together to make sure that this happens, because it is very important that it happens so that every mother, every father, every family has access to MCH services through the MCH Handbook, which is the integrated record that helps people to be well. And MCH services are really important because there is now very established evidence that the health of the mother during pregnancy influences the well-being of the child and has an impact on the quality of life of that child. And we in Africa, like everybody else in the world, we want high quality lives. Therefore, the best way to do this is to make sure that every child, every pregnancy, every mother who is, every family which are expecting a baby have got the MCH handbook. Now, we may not be able to immediately build health centers close to every home. We may not be able to have wonderful roads which take everybody to the health facility. We may not have the means, the economic means, to move everybody so that people can afford to go to health facilities. Even in Kenya, where we have had free mother and child services for some years, the utilization is still very low because very many people are still far from health facilities. Therefore, it is very important that we adopt the use of MCH Handbook owned and kept a home-based record that is utilized to improve the care in pregnancy, the care in delivery, and the care of newborn and young children up to an age that the country decides. This is particularly important because with a handbook, you have a trained person in the community. Therefore, they can take the blood pressure of the mother, they can find out whether the mother is anemic or not, and get this mother to health facility so that the mother gets the care that they need. They can also keep in touch with the mother regarding the delivery date so that the mother makes sure that she has a facility-based delivery, which is very important for the survival of the child and the mother. So these are all very good points and very important points for using the MCH handbook. And this is why Africa must be part of the global community in promoting and utilizing the MCH handbook in this global movement for the promotion of MCH handbook, so that we in the world are together and are all of us experiencing high quality life and high productivity for the improvement of the quality of life on earth and the improvement of the peace and economic well-being on earth. Thank you very much.
Well, I think this was a wonderful presentation from Professor Miriam Moy, and really also important in view of the theme of the webinar, and of course for the whole the child and mother and healthcare all over the world. We are very pleased that a colleague of her, Mrs. Lydia Karimurdia, is joining us now, and she would like to share some of the experiences in Kenya since the COVID-19 pandemic last year. So please, I would like to give the floor to you and share your experience with us.
Thank you very much. Good morning, good afternoon, good evening to everyone. I take this opportunity to to present on our experience in Kenya, especially in the utilization of MCH Handbook, as even during the COVID pandemic. And I'm just starting by showing what our country looks like. And as you can see, it's divided into many sections. Those are counties. It is, we have a government, one national government and 47 county governments. And how did we start with the MCH Handbook? The MCH Handbook, which is a home-based record, and it is kept by the mother or guardian. It was developed under a wide consultative process involving the Ministry of Health and partners. It was initially piloted in two provinces, in one of the provinces in the country, and that was in 2008, 2009. It was later in 2010 officially launched by the Minister for Health, And this led to a wide scale up in the utilization of the handbook. The handbook improves communication and knowledge sharing between the families and communities and the family and the health facility service providers. And it also strengthens the linkage between facility and community. And it is viewed as an integral part, an integral tool for the first 1,000 days of life. The current implementation status of the handbook in regard to the national health system linkages. The MCH handbook is integrated in the national health system. It even has a number, Ministry of Health 2016, and it is also linked with the MNCH maternal newborn child health data linked to the Kenya Health Information System. And implementation, as I've said earlier, is in all the 47 counties. The printing is supported by Ministry of Health and partners, and it is done annually, mainly coordinated at the national level, and distribution is also done to the counties where it's implemented. The distribution is usually aligned with the vaccine distribution of the vaccine commodities. And some of the partners also support printing for the counties where they're supporting implementation of maternal, newborn and child health services. Coordination is done by Ministry of Health through Department of Family Health. The handbook has been revised. The current edition is of September 2020. Capacity building for effective utilization is ongoing, though we are still low in coverage. Country maternal child health system in the era of COVID-19 pandemic. The first case of COVID-19 was in Kenya was reported in March 2020. And to start with, fear visiting the health facilities because they feared to contract the disease from the health facility. Some patients and clients were turned back from the facility simply because even the health workers were also fearing contracting the disease from the clients when they went to visit the facility. Policies and guidelines were to address this. We had policies and guidelines developed, mainly adopting from the WHO guidelines that were released, both for prevention and also for care. And then we also had guidelines in prevention measures were developed and also disseminated at the various levels, national and subnational levels. Issue of stigma associated with the COVID-19 is still there, and this is still leading to low care seeking for maternal, newborn and child health services. Yeah, and as you can see, when we get to the health facility, the health workers, this picture is just showing that the health workers are using the MCH handbook to counsel the mothers, both for the antenatal care, delivery, postnatal care, and care for the newborn and child health, and also on issues of COVID for prevention and care. Country maternal child health system in the era of COVID, and you have in Kenya community health. How is the community involved? How are the communities involved? In Kenya, we have community health structure, which is used for service delivery at the community level. And we have community persons whom we call the community health volunteers. They provide services at the household level. So these community health volunteers have also helped in disseminating messages in prevention and care seeking. and also assisting in establishing structures for prevention and also for care, for home-based care, even for COVID. And the community volunteers also, they identify the suspected cases of COVID-19. They also link them with their supervisors, whom we refer to as community health extension workers or community health assistants. And these are the ones who will then link with the testing, with the services for testing and care. And there's also the community health volunteers also form linkage between the health system and the community for prevention and also home-based care and also isolation for COVID-19 cases. So as we said earlier, there was stigma resulting due to fear in seeking care at the health facility. We also have health workers having problems because of lack of enough adequate supply for PPEs. There's low purchasing power for the PPEs at the household level, and you may find people walking around even without the face mask. Then there is rising numbers of infection among healthcare workers. There's also inadequate compliance to COVID-19 guidelines and protocols. There's inadequate testing capacity, and also frequent health workers industrial action, mainly based on issues of lack of PPEs and other requirements. And this is the current, as I alluded earlier, we have revised the MCH Handbook, and this is the current copy, which is of September 2020. And with this, I say the MCH Handbook brings us all together, and thank you very much for listening. Thank you.